Hello, everyone. This is Bob Gelinas with the Soft Ingenuity podcast from SoftNG. We're your gateway to digital transformation. Today, we have a very unique topic we're going to get into with my special guest, Nina Sharayevskaya, who is the head of our EHS, Environmental Health and Safety Department here at SoftNG. And specifically, we're going to be talking about the technologies within extended reality, and more specifically, virtual reality and augmented reality, and how those things are being used in EHS area for our safety and training and lots of other things like that. So let's just get right into it. Nina, welcome. Glad to have you here today. Hope you're doing well, and so hopefully you can help us understand some of these technologies better.
Hello, Bob. I'm very glad to be here today. So, with regard to your question, use areas of VR or AR are currently very wide, mainly due to the restricted live interaction caused by COVID. The pandemic brought many changes, and the technological world could offer the best responses to the new needs. So COVID-19 served as a driver for digitalization. Communication has assumed even greater importance during the pandemic. Even after the vaccine is widely adopted, many companies will allow their employees to continue working remotely. According to Gartner survey, 90% plan to allow employees to work remotely, at least part-time. This will mean permanent changes to the way companies approach workplace safety. For instance, there is a high chance that in future, meetings will be held in virtual reality, as it minimizes health risks and preserves the effect of presence. It's difficult to believe in it right now, but who knew we would have Zoom meetings instead of personal talks 10 years ago?
That's true. And it's very interesting, but I still think it's a little bit weird. On the other hand, I think the application of augmented reality and virtual reality for a safer workplace makes a lot more sense and is very relevant. Is that true?
Yes, it's true, and you are right saying this. Pandemic makes it impossible to teach and learn in person. How should workers unload, for example, hazardous materials, configure a wind turbine, or service nuclear power plants or oil platforms? We've already witnessed companies grappling with these changes in 2020. But this year pushed safety professionals to rethink their practices and explore new opportunities for connection and collaboration. And one way to do it is to use virtual reality or augmented reality to simulate those environments for workers to practice in. Overall spending on AR and VR rose in 2020 to $12 billion globally. It's up to 50% comparing with 2019. And this percentage will continue to rise. Using virtual reality, it's easy to show employees how to work in volatile and risky conditions remotely. For instance, it's possible to recreate a 100% accurate environment of the oil platform, for example, and train future employees using VR instead of a physical facility. AR-based virtual user manuals provide details on vehicle dashboards or give workers insight into the factory machinery. It's also possible to use augmented reality for remote assistance of specialists. For example, if maintenance or fixing is required and specialists have to work remotely, they can use AR apps for creating visual guidelines. I would also make one more example. AR or VR allows to engage specialists remotely from all over the globe, especially when particular knowledge is required. It's primarily important for specific industries and unique experience sharing. For some cases, this experience may be life-saving. Here we can name not only emergencies or cases of imminent danger, and also medical treatments. So with AR and VR, it's easily achievable.
Okay, so let's say I went to work for an oil or gas company. Are you saying then that I could have my onboarding training and so forth in virtual reality or augmented reality in a much safer environment?
Yes, exactly. Moreover, virtual reality can be efficiently used for emergency training in dangerous situations or to train and boost the level of emergency preparedness. In professionals where inadequate safety procedures are a huge risk to the employee, such as industrial assembly lines, quick service restaurants, frontline utility works, or oil and gas station, it's critical that employers guarantee safety training is effective and accessible. Virtual and augmented reality allows employees to learn without putting them in potentially unsafe situations, such as firefighting simulation, for example. Such solutions are ideally designed to help in emergencies and post-emergencies. The training scenarios are carried out in a safe environment, but felt very real. So VR is safer and less risky for employees, for sure. Also, with virtual reality, people don't need to travel to access training devices, and they don't need to bring heavy equipment to special training location.
Okay, but in terms of training in general, what you've described here sound like very volatile situations. I mean, can these technologies be used in a more broad sense on less dangerous type things?
Yes, absolutely yes. Standard training procedures may no longer be possible. COVID-19 has forced companies to systematically review, rethink, and reimagine employee onboarding and training. Virtual learning offers a chance for companies to create a standardized documents and video to ensure all employees have a baseline knowledge of proper safety protocols. VR and AR technology can support just-in-time learning to teach employees in a more flexible way, on demand and whatever. The technology enables gamification to be used to create engaging, immersive, and potentially more memorable learning experience than just listening to hours of lectures or reading sometimes boring pages of materials, that is why virtual and augmented reality are perfectly designed to improve and even enhance human experience we have during any type of training.
Okay. You mentioned earlier that a lot of this sort of the catalyst for using a lot of these technologies came from the COVID epidemic. But we're all hoping that someday that pandemic is going to be over and we sort of get back to some normalcy in life. So that sort of begs the question of, what is the future of a lot of these technologies? I saw just in the news recently that Facebook is going to be renaming themselves and primarily focusing their future around what they're calling the metaverse, which seems to be very centrally organized around technologies like virtual reality and augmented reality. So what do you see as for the future of these technologies?
Yes, I'm absolutely agree with you. And the example you just provided about Facebook, it's one of the good signs that this technology will have a great future. So from my opinion, the unexpected coronavirus pandemic has turned the working world upside down overnight.
Mm-hmm.
Remote work has become the new reality for many of us. Many experts agree that the overall acceleration of digitalization during this time will have a long-lasting impact on occupational safety, for example. Safety trainings and education are considered to benefit most directly from this development. Safety risk is a real challenge across nearly every industry. Let's imagine it's frontline retail employees exposed to robbery incidents, or manufacturing workers operating potentially dangerous machinery, or hazard identification in the field. Workforces face risk. To minimize liability issues and, more important, to protect people, every organization stands to gain from going beyond traditional types of training.
Mm-hmm.
Using these technologies allow employers to improve safety outcomes, to increase preparedness for something unpredictable, and to boost employee performance while also significantly reducing the cost. So, scalability, effectiveness, improved safety outcomes are some of the reasons why VR can definitely have a future. Some experts predict the industry will reach a total $73 billion in 2024.
Wow, that's a lot. Well, tell you what, let's take this conversation in a little bit different direction. If you would, Nina, let's talk a little bit about how VR and AR are used in areas like healthcare. You mentioned that briefly already, but is that a great place for it to be applied? And if so, how does that work exactly?
Yes, Bob, they definitely could be and already used in the healthcare industry. Virtual reality solutions are overall changing the way we think about medicine. These techniques are being increasingly adopted in surgeries and diagnostics. VR trainings are already helping doctors to train to conduct complex operations without any risk for patients. Systems such as touch surgery use virtual reality to provide a view of the patient anatomy and psychology, thereby assisting doctors in the operating room. Additionally, AR is being widely adopted for education and training purposes for medical personnel, and we will already discuss it today, this topic. Since AR-based learning modules provide anatomical visualization and simulation, it gives the medical personnel a more wholesome, complete learning experience, Similarly, Imperial College and St. Mary's Hospital in London are using augmented reality glasses to visualize 3D imaging of blood vessels during reconstructive surgeries.
Wow.
Yeah. AR and VR in healthcare are gaining momentum due to widespread adoption in telemedicine, medical training, education, patient care management, medical marketing during the COVID-19 pandemic.
Wow, that's amazing stuff to actually get your head around and understand. Well, the clock on the wall, Nina, says that our time together here is about up. I want to thank you so much for joining us here today on the Soft Ingenuity podcast, and I'm excited to see what great new tools come out next.
Thank you, Bob.
Okay, bye-bye.
Bye-bye.